Rib flare is a postural condition characterized by the lower ribs protruding forward and outward, creating a noticeable gap between the rib cage and pelvis. While it is not inherently dangerous, rib flare can indicate underlying muscular imbalances, poor breathing mechanics, or structural issues that affect overall posture and function. One of the most common causes of rib flare is weakness or poor coordination of the core musculature, particularly the deep abdominal muscles such as the transverse abdominis and obliques. When these muscles fail to stabilize the rib cage, the ribs tend to tip forward and separate from the pelvis. In many cases, rib flare accompanies an anterior pelvic tilt or excessive extension in the lower back, both of which disrupt normal spinal alignment. Additionally, dysfunctional breathing patterns, such as chest-dominant breathing rather than diaphragmatic breathing, can reinforce the outward positioning of the ribs. The implications of rib flare go beyond appearance. Because the rib cage plays a vital role in both respiration and spinal stability, flaring can impair efficient breathing mechanics and limit the diaphragm's ability to contract effectively. This may lead to compensatory overuse of secondary breathing muscles, such as those in the neck and shoulders, contributing to tension and discomfort. Moreover, the altered rib position can increase stress on the lumbar spine, potentially causing low back pain or predisposing individuals to injury during physical activity. Addressing rib flare typically involves a multifaceted approach. Strengthening and retraining the core muscles is essential, with particular emphasis on the obliques and diaphragm to help pull the ribs down and in. Corrective exercises such as dead bugs, 90-90 breathing drills, and controlled planks can be effective. Stretching tight muscles, especially those of the lower back and hip flexors, also aids in restoring balance. In addition, learning proper diaphragmatic breathing techniques helps integrate core stability with respiration. Over time, these strategies improve posture, reduce compensations, and restore more efficient movement patterns. In conclusion, rib flare is often a sign of underlying imbalances rather than an isolated problem. By strengthening the core, practicing better breathing, and correcting posture, individuals can reduce rib flare, enhance stability, and improve overall function.